As of today, cumulatively 549 cases have been confirmed. Of the confirmed cases, 541 are active cases. We would also want to extend our sincere condolences to the family of the first death related to COVID-19. And we are with them and give them our support. We have started to use a differentiated approach in our response through the identification of target areas and hotspots. In the targeted areas and hotspots, the focus continues to be on prevention of new infections, containment, mitigation, and recovery. The overarching objective of the Emergency Operational Center, which we have established, is going to strengthen the regional mechanism for timely detection, management, and containment of the spread of COVID-19, with 10 overarching strategic pillars that will be focusing on the activities to respond to the COVID-19. These pillars are providing leadership and coordination. That's pillar number 1. Pillar number 2 is logistics. Pillar number 3, mental health and psychosocial support. Pillar number 4 is surveillance. Pillar number 5, quarantine and isolation facilities. Pillar number 6, case management. Pillar number 7, risk communication and community engagement. Pillar number 8, ports of entry. Pillar number 9, security cluster. And pillar number 10, infection prevention and control. This operational center is functional and is located at the municipality of Walvis Bay and consists of major stakeholders. During this week, I've also invited the private doctors and the fishing sectors to form part of the Emergency Operational Center to provide their input and support, which will enable us to achieve our objectives. But now it is no longer a matter of announcing numbers or confirmed cases. We are now at a point where it's our fathers, mothers, brothers, sisters, close friends, and comrades that are infected with this COVID-19. As a region and nation at large, we are now in this reality where we must live with knowing that some of us cannot even bury our loved ones, as you have also seen with the colleagues that just expressed their concern, and it's based on the restrictions in the regulations that have been put in place. This pandemic that is attacking us globally will cause some of us lifetime scars. Of course, imagine if you cannot bury your loved ones during this time, it will be a long scar that you will have for a very long time. And of course, this COVID-19 is also stealing our jobs and our businesses. It spares no race, no gender, no social class. It is affecting all of us. And it is important that we then need to stand together in these trying times. This week, we have also started with food distribution on Monday, which was particularly in Walvis Bay. And as of yesterday evening, a total of 1,010 hampers were packed or packaged. These hampers consist of cooking oil, butternut, and cabbage. And I would like also to argument or to thank the municipality of Walvis Bay for assisting in terms of adding to the resources that we had. They had contributed an amount of 250,000 to buy or to add on the parcels, food parcels that we have been distributing. In Swakopmund, there are 111 houses under the Mass House scheme. But these houses, as per our information, are currently under litigation and cannot be occupied. So basically, the 29 houses are ready for allocation, but the 111 houses, there is a litigation on those houses. Other solutions to relocate people temporarily is being sought out, so we are still engaging the two municipalities, more specifically the municipality of Walvis Bay, to sort other engagement or other possibility and seeing how do we relocate people there. I would like therefore to thank the both municipalities for their excellent cooperation during this week. It is therefore my hope that upon the removal of all stumbling blocks, the relocation process can start as soon as next week. In fact, the process will start already as from Monday in terms of ensuring that we have those spaces or those areas ready to relocate people to those areas. Issues pertaining to schools in our region. I must inform the media that we had a very cordial meeting, and the participants or the principals from the private schools raised their issues with us and wanted these issues to be considered. Amongst other issues that they have raised are that schools be reopened for grade 11 and grade 12 learners, that learners are experiencing depression due to the fact that they might lose out in their future plans, that their parents are being retrenched and facing possible retrenchment, so they also might be recalled from or might be taken out of their private schools. Also that the e-learning has its own challenges, as most learners do not have access to internet or cell phones that can access those applications. Mostly challenges faced by students who does technical subjects are the practical part where face-to-face contact is required. So those students that having practical subjects also have a serious challenge in the school. The meeting therefore tasked the Regional Education Director and her team to take their grievances and concerns of the educationists up with the Ministry of Education in Windhoek. I'm therefore also pleased to inform today that based on the feedback received from the Regional Education Director, an appeal letter has been launched with the Ministry of Education with motivations. We are now just waiting feedback from the Ministry of Education in terms of those issues that we have raised or that we have forwarded to the ministry. I should also mention that I was very inspired by the cooperation between the Ministry of Education, the private school principals, and the public school principals, because they were all part of that meeting that we had. Furthermore, I also had a meeting with the private doctors, mostly private doctors in Swakopmund and Walvis Bay, who extended their support and help during this pandemic. They've informed us that they would want to give their services by donating and assisting the public Ministry of Health and Social Services in terms of giving their services and see where they can assist, which I have instructed that they should come up with an agreement on working modalities on how they are going to help us and work together with the public health care workers. Yesterday I had a separate meeting with hake and horse mackerel sectors. These are the fishing companies. As you know, this was a follow-up meeting. The first one was last week. The sector once again reiterated their support to COVID-19, but they also shared with me uncertainties on the new quotas that they have, that was announced to individual companies. They also have shared problems with regard to the foreign crew at their vessels and the quarantine protocols, as they would want most of their crews to be quarantined on the vessels, which is safer and less costly. The regional director of health has been tasked to look into the issue and settle the issue and report back to them. I should say that after the director of health consulted the executive director in Windhoek as well as the minister, which of course she will come in and clarify, it was agreed that the ministry grant permission for the crew to be quarantined on vessel, subject to established protocol, which includes an officer from the security cluster be stationed on the vessel, that a qualified medical practitioner be on board of the vessel to check the daily temperature and apply other necessary medical duties, and that no one should be on the vessels when the crew change happens. I'm happy that we could finally resolve this issue, and I want to thank the involvement of Dr. Amir and Ms. Anna Jonas for the prompt response in this issue. On Monday, 6th of July 2020, during his COVID-19 update, His Excellency, the President of the Republic of Namibia, Dr. Hake Geingob, announced that due to the rise in confirmed cases in Walvis Bay, there is a need to decongest informal settlement in Walvis Bay, mostly in Walvis Bay. The President then directed the Ministry of Urban and Rural Development and the regional and local authorities to identify suitable venues or facilities with adequate provisions of water and ablution facilities where residents can be temporarily relocated. Furthermore, His Excellency also stated that a request was done to me to investigate the feasibility of using There are unallocated mass houses, both in Swakopmund and in Walvis Bay, to place people there as a relocation. I would hereby want to report back, based on my consultation with the two municipalities, and that's why also we have them here today. Municipality of Walvis Bay is the mayor, and the municipality of Swakopmund. In Walvis Bay, the availability of the 60 mass houses, and in Swakopmund, 100 houses. After interacting with both Walvis Bay and Swakopmund municipality, I am pleased to announce the following: that the 60 houses under the municipality of Walvis Bay, as of today, will be allocated to the beneficiaries who were on the waiting list, and of course, who did not have houses before. So, and I've been informed that that process was concluded today in terms of allocating the 60 people to those houses. Furthermore, I'm also announcing that the inhabitants in congested spaces will be relocated temporarily to extension 16 and 18, and that the Walvis Bay municipality will enter into a temporarily contractual agreement with the people who will be moved to those areas. A total of 600 community members will be moved to the new sites, which is adjacent to Taroloka informal settlement, and also that extension 161 and 162 in Swakopmund will be utilized to relocate people as well. The municipality of Swakopmund will service the areas at their own cost. In addition, both local authority will avail their stadiums and other buildings to relocate more people that would require additional accommodations, and to some extent also to serve as quarantine facilities. There is equally additional 29 houses in Swakopmund for immediate occupation that will be done considering the existing waiting list of NHE.
We have submitted it to our stakeholders, it was NHE. They are in the process of verifying the names of those beneficiaries, of which at the end of the day, they will then be handed over the keys to get into those houses. About the 100 plus houses, I think Honorable Governor mentioned it, that some of those houses, those are the houses that are under dispute at the higher court level, and it's a bit difficult for us to give a clear answer now.
These cases are actually from the 3 districts within the region, of which the majority, the 541, are from Walvis Bay. And then the majority of our cases are also from, 98% of them are from the Swakopmund suburb. We keep on getting requests from especially this time of the year. I think it's the time that vessels or crew members are exchanging. So yesterday, then we had a flight that landed in Windhoek with on-signers of 127, as well as then the off-signers of 145. So as indicated by the Honorable Governor, these people will be quarantined on the different vessels. But it's not the first time that we actually allow people to be quarantined on a vessel, except the ones that are coming in. We had people that had, leaving the sea, being quarantined on the vessel for 14 days, and then tested on day 12 before they then disembark. So the other thing that we are also busy with is we are trying, as I've indicated, we have an increased number of COVID-19 cases. So we are also trying to, increase our capacity in terms of human resources, sourcing human resources from other districts, as well as to also engage our national level to see if they can give us more people. So we've received cleaners, as well as some environmental health practitioners, porters, just to, to mention a few, to assist us in this, difficult time. Again, with the increasing of new cases, we are also in the process of identifying more isolation facilities. In addition to identifying more isolation facilities, we are also converting one of the garages at Walvis Bay to also serve as an isolation facility. So I guess some of the concerns that we are receiving is we have more people that are still moving in and out of the region. As of the 9th, I'm talking about referring to the Arandes roadblock. I think the staff, they have screened more than 846 people that are coming in and going out, which is actually a concern to us, because we are not actually encouraging, or we are discouraging people to limit their movement coming into the Erongo region, as well as the going out of the region. Only people that are really, seeking for medical services that are not available here, or that cannot be postponed, or providing essential or critical services are expected to be allowed to go out of the region. But again, the request of permits and so on, especially I think from the police, people want to leave the region, is still on an increase. So again, we just appealing and encouraging people to actually limit their movement during this time.